Osteoporosis is a common problem that affects both men and women and is a big problem because it can really lead to a lot of disability long term. So many times we're approached with folks that already have osteoporosis, and maybe it's actually severe, in which case we're trying to reverse the osteoporosis that already exists. There are a number of medicines that can be used to help with this, but these medicines also have known possible side effects. They usually do not cause problems, but they can. And in many cases, women and some men are interested in learning what can be done to decrease the osteoporosis before it occurs. In other words, to prevent it from happening. And so there are some fairly straightforward things that can be done to improve bone density. One of the things that can be done early on is for young people to make sure that they are getting enough calcium in their food or as supplements early on in life, so that during that time when the bone bank deposit window is still open until mid-20s, you can start making deposits into your skeletal bank. And so many times this involves simply making sure that you have enough calcium in the diet, or that you are actually taking a calcium supplement for the first 20 or 25 years of life. So the use of calcium as a preventive really is an early life, childhood kind of activity that we want to do. What do we do to prevent osteoporosis after that time, but before osteoporosis has actually occurred? Well, there are some other principles that are important as well. One of them is that there are other compounds that are necessary for bone health. One of these simply is vitamin D. Not only does this improve calcium absorption, but it also is very important in moving calcium into the bone and strengthening bone calcium deposits. Another thing that is very important is a vitamin called vitamin K2. Another thing that this does is it increases the chance that vitamin D will have its effect upon bone rather than increasing calcification in the blood vessels, which is not what you want. So vitamin K2 is important in that function as well. But there's a third thing that can also have impact on that blood vessel calcification problem, and that is magnesium. Now, magnesium also decreases the chance of having calcium developing in the blood vessels, and magnesium is a very important component of bone health. The last thing, though, in addition to getting enough vitamin D, getting enough magnesium, and getting enough of the vitamin K2, is to remember that your bones, which are living tissues, will not make use of these supplies unless you ask them to. And so for that, you need to put stress on the bones in order for the bones to realize that they need to build up strength in a given direction.